Good morning, everyone, and welcome to the Richard Kim Medicine Podcast, the medicine that moves you. I'm Olivia Harrison, and I'm actually the guest on today's episode. We are here today with our host, Dr. Richard Kim, and Chief Clinical Nurse, Craig Ullman.
Thank you, Olivia Harrison. Thank you for the introduction. And hello, everyone. My name is Dr. Richard Kim, regenerative and sports medicine physician.
And my name is Craig Ullman. I am the clinical nurse for Dr. Richard Kim at Richard Kim Medicine. Today's episode is titled
Stem Cell and Knee Pain. As we plan on exploring and discussing and a little bit about stem cells and knee pain and the combination of the two. What we want to do now is introduce a little bit about our guest here. Just give us a few broad strokes as to who you are, where you're from, stuff like that.
I'm a mom of two teenagers. That's first and foremost. I'm also an assistive technology provider, which means that I give children the chance to have a voice via technology. I'm pretty active. I feel like I'm pretty creative with my adventures and going about. The job itself and my two kids keep me pretty busy. So I need to keep in shape. So I go to the gym. Being creative and going on adventures is really my gig.
And we should mention we're based here in upstate New York. So you yourself are here in the Saratoga area?
I am.
Right?
Yes, that's right.
Excellent. So in talking about some of this, and we want to sort of deliver to people what not only stem cells are, but, what it's like to go through this process. I think before we talk about some of the details about the science of it, the medicine of it, and all of that, we want to talk a little bit about to give people an idea and expectation of what their life was like before and what their life is like afterwards. In your mind, what sort of physical activity would you say you liked to do growing up? And what sort of physical activities do you like to do now?
So growing up, I played 4 sports. I swam in the summer. I played field hockey, basketball, and track. I also went to the local college on a scholarship for running. So I
didn't know that.
Very active.
Scholarship for what?
For track.
For track. Okay. What were your events?
I did long distance. I did 2 mile.
Yeah, that's a hard one.
It is. And it really meant a lot to me. I got it in the zen of running. And it's important to me to be able to go down and enjoy the stomping and the repetitiveness of running. That means a lot to me.
And did you, was that Division 3, Division 1?
It's Division 3.
Okay.
It was at the College of St. Rose.
And then you did that all for 4 years?
I did it for 3 years.
Okay.
I was redshirted actually for the first year because I had my knee surgery, my second knee surgery going into senior year.
What sort of injuries sort of took place for you throughout that process?
So my senior year of high school, I blew out my knee during field hockey. I tore my meniscus and I destroyed my ACL. So I ended up having 2 surgeries my senior year of high school and carried over through my freshman year of college. We had a lot of complications with scar tissue.
You did say you redshirted a year?
I redshirted my freshman year of college.
Okay. And recovery from the surgeries were all sort of unremarkable, or
No,
how did that go?
It was traumatic. I had a lot of scar tissue, so there was a lot of manipulation of my knee through my physical therapy. It took 9 months of physical therapy.
From each of the surgeries or from the combination of the two?
From my ACL reconstruction.
And what type of, long-lasting effects post-surgical? How did, you heal? How did you recover?
So I thought I recovered pretty well until I kept having knee issues when I was jumping with my kids or going hiking. And I ended up having 2 more left knee surgeries. And it was just the meniscus each time would just keep tearing.
That's not an uncommon course for when you do start tearing a meniscus. You're sort of subject to being exposed to tears again. And unfortunately, that sounds like a pretty typical course.
Why is that?
Well, I mean, if you think a little bit about how the meniscus is shaped, it comes down to basically a point or a flat end. When you operating on a meniscus, they're basically trimming back that point or that flat end. And so what you're left with is a wall. And then that wall can then develop degeneration again and little, basically fronds like an enemy. And you can go back and tear that again. So unfortunately, once you've torn it once, you're at exposure to tear it again. And so even though it's an immediate quote unquote fix, sometimes it's a short-term gain and then a long-term loss, unfortunately. That's part of injury, meniscus injury. I guess in just knowing that you've got a meniscus injury, it's part of it too is knowing what your limitations are. And it sounds like for you had some significant limitations from sport. What would you say your 3 years of college running were like?
Tough. I knew that I always had to take care of my knee. I was always conscientious of my knee, especially down in Albany where St. Rose is. We didn't have an indoor track locally, so we'd have to run downtown Albany to the Armory. And that got tough because I'd have to watch the sidewalks and I'd have to watch the ice. And even on a nice day, I would still have to watch the glare off of the puddles. And I'd have to become super conscientious of my knee and just, I didn't baby it, but I definitely took note of it when I was running.
That's probably how you'd been living life, right? Since college, since these injuries and these surgeries. That brings us to sort of present day when you and I met a year ago. Would you say that that's about where life was?
Yeah, I would say last December, I was running on the treadmill. I felt really good. And I was just running my normal couple miles, nothing intense. And I just misstepped a little bit. And I knew that what it felt like. And I knew that it was going to be a meniscal tear. And I knew it. I stepped right off the treadmill and went to an orthopedic surgeon. And that's when this whole journey started with stem cell.
Keep going down that path a little bit, because I know that it's a bit of a journey when somebody makes this sort of decision. And I think yours is, I don't want to use the word typical, but yours is pretty common. What sort of happened next for you?
Okay, so I went to actually the emergency orthopedic and they wanted to do an MRI. And because I've had so many surgeries beforehand and so much hardware in there, they wanted to do it with contrast, but no one told me that we're going to do it with contrast. And I have a great fear of needles in my knee because it is so painful. Even on my good days, it's still, conscientious of it. And so I went for an MRI and they wanted to put contrast in my knee and I refused it because I was too scared of it. So we went on for a couple more weeks and I couldn't walk more than 5,000 steps without being in pain. I was taking Advil every night. I couldn't sleep. I was icing it. Absolutely no running. Walking was a bear just to do my normal job in my normal life. And then we went for a regular MRI and it turns out that I had another tear, which I had thought because I had felt it before. So that brought me to the consultation with the orthopedic surgeon. And he gave me a couple of choices. And the choices were either cadaver or a partial knee replacement.
When you say cadaver, you meant as a meniscus replacement?
That's right.
I see.
So at 43, I didn't feel like that was the best choice. Either one of those choices were an option for me. Yeah. So I went on for a couple more weeks trying to figure out what to do. Yeah. And I was heading to Florida for vacation with my parents and my family. So I ended up getting an injection just of cortisone.
Steroids,
just to patch it up. I don't typically put anything in my body that I don't need. So even though it was against what I normally do, I felt like it was...
Like what choice did you have, right?
So I wanted to have fun with my family in Florida and be able to walk on the beach, which is always a problem for me, is walking on the sand.
Sure.
But I wanted to go have fun. So I did a cortisone shot and it worked for about a week, which was perfect timing because I went down to Florida for a week. But I knew that I had to make a decision that I couldn't keep living like this.
Yeah. How typical of a story do you think this is when we sort of are listening to Olivia here?
I mean, it's quite common. People, you don't tend to think about, the injury or injury to yourself until you're, living it and undergoing it.
Yeah.
And, it makes you think about everything. Like, I believe in the past, Olivia, you had said, thinking about planning your day around how much you are going to have to walk.
Yep.
That's quite restricting. And it's, it can be isolating and, depressing. And
Yeah, even my grocery shopping would have to be cut into sections. I couldn't do one grocery shopping all in one day.
Yeah. So like one day produce, and then the next day you can go pick up your cold cuts or something like that.
It was like really meal by meal, like what I could do for tonight for my family versus, a whole week's worth of food. So I had to separate it because I couldn't walk it.
Yeah.
And that's tough. I mean, people that don't have to undergo, planning out their day, due to, how is my knee going to feel? We take our health and our well-being for granted until we're, affected by it.
Yeah.
Yeah, totally.
And I feel a lot of our patients that come in are, they're in similar situations. They're tired of having to think about their knee and think about what I can and can't do.
Sure. Because really, you don't want to think about it. You just want to do this. You just want to live life, right? And you don't want to be sort of having to halt and think about what's next.
Right.
Your brother somehow gets involved in this, right? Because your brother's a chiropractor.
He is.
So talk about that a little bit for us.
So I was brought up with having a holistic feeling on medicine. My brother's a chiropractor. We've gone to our chiropractor since I was in early elementary school.
Sure.
So we really try to, keep healthy without having medicine, meaning chemicals that we don't need be put into our bodies. So my brother really was pushing for losing weight was the number one thing that he suggested that I do right away. And not that I was overweight, but I really did need to take off some weight, and thinking that was the easy fix to keep pressure off of my knee. That didn't really work. It worked physically for me, but not for my knee specifically. So he wanted me, to do lots of proteins, eating lots of proteins, lots of turmeric, lots of like vitamins that, might be able to help me, which I still take now. I take 5 vitamins. So, I'm staying active with, keeping my body healthy from the inside, but I knew that the knee was damaged and nothing could really help that as far as what I thought.
Your life approach to medicine and what you put into your body is absolutely what we would all like it to be, but that's kind of not the current face of healthcare, isn't it? That's not exactly how we sort of treat ourselves. In your navigation in some of this, do you feel like, I don't want to say that it's either failed you or it's, been successful for you, but, what are your thoughts on sort of how we navigate the current healthcare with sort of injuries like you've got?
I had 2 choices, and they were pretty radical. And I didn't feel like...
The 2 choices being either the meniscus transplant or getting a partial knee replacement.
That's right.
Yeah.
And especially because I'm so young that I felt like it was sort of just Band-Aids, and they were big Band-Aids, and there were large risks with putting stuff in my body that were foreign to my body. And I had a really hard time with that.
In going through all of that, though, at what point do you think like that was the worst? That was rock bottom. Like you couldn't take it anymore for you?
Yeah, I couldn't. When it affected my job and working with students, everyone was safe and everyone understood. But it was more the fact that because I travel for my job, getting in and out of the car, walking into each school, seeing a student, getting out of the car, going back into the car, back and forth was a lot for me. So I think once it affected my personal life and my school life, I knew that something needed to change quickly.
Yeah, I think that's sort of the critical point. Do you think it was necessary to get to that critical point, or do you think you could have maybe pulled the trigger on doing something for your knee and your health beforehand?
Oh, I think if I knew that this was an option beforehand, I would not have gone through, 4 pretty extended, painful months.
Yeah.
It really took... I thought I was out of options. I thought I was really going to need a knee replacement because in my mind, the cadaver wasn't a good enough choice for me.
Sure.
So I ended up just having a regular physical with my primary DO, and she's about my age. And I asked her what to do about it and what would she do if she was in my shoes. And she said, "You're not doing the other two. You're going to do stem cell." Yeah. So.
And that's kind of when you and I sort of finally found each other.
Yeah, I mean, I guess so, right? Like I said to her, I can't go to Boston and New York City.
Sure.
And she said, "No way, there's someone right in town."
Yeah.
And I had no idea. So yeah, that's when we met.
When we met and we finally made the decision and we decided to move forward with that, I think it's an important thing for people to hear and understand what that process is like. And, a big person in all of this is Cragen, and Cragen gets to see, watch, and be a part of all of that. Describe for people what you think that process is like, sort of from soup to nuts, and Cragen, sort of talk a little bit about the stem.
So a stem cell procedure with us at Richard Kim Medicine it's something that you come into the office, you basically get changed into a pair of disposable shorts and a gown, you get your blood drawn, and then basically we turn on the tunes and we get started.
Yeah, we always let you pick your music.
Yeah, what was your choice?
Mumford and Sons.
Oh, yeah, that's right. That's right.
That was good. and basically, you're awake, you're alert. We're having a conversation. We're talking about, the good old days, sharing life stories.
Where to eat in Saratoga.
Yeah, that's an important one.
Yeah, that was...
Yeah, if you plan on having this procedure done, come with food recommendations.
Yes,
that's important to us.
And... the extraction process where we extract your stem cells, it typically takes about an hour. You're lying face down on a stretcher, just kind of in a relaxed position. And Dr. Kim does the stem cell extraction. And after that, you're able to get up. You can go to a comfortable waiting room and hang out while, that stem cell material is being processed by myself. And that takes about another hour. And, after about 2.5 hours, everything is kind of complete. And the only thing left is, just the injection portion of the stem cell material into the joint of interest. And after that, you basically get changed and you walk out. So, you walk in and walk out the same day. There's no sedation. So there's no extended time that you have to stay in the office and kind of come to or recover from any anesthesia.
I mean, that's typically something people, like is not having to go under for general anesthesia.
Yeah, can I just interrupt for a
absolutely.
second?
Go ahead.
So Cragen just explained to everyone what happens on his point of view. My side of it is, I think mentally, it was harder than physically. I think my head got in my way. The actual extraction, it's a lot of pressure, but it's nothing that I would have ever dreamed that it was going to be as easy as it was. I'm not saying that it was totally easy, but it was totally doable. I mean, Dr. Kim, you talked me through it. We, I knew how much longer. It didn't seem like that long to me.
After the procedure was all said and done, what are your final thoughts about the procedure? Was it incredibly taxing, or was it, pretty easy to get through?
I thought it was relatively easy to get through. I appreciate that there's some time in between the extraction and the actual injection. It gave me some time just to sort of breathe and get myself ready for the injection that I knew was going to be, life-changing.
Well, and your kind of distaste or fear of needles. I mean, how is it getting an injection at Dr. Kim's office?
It's nothing. I know it's only going to last a second, and he talks me right through it. Because he uses the ultrasound machine, I know he knows exactly where he's going, so it's not going to happen more than one time. I have no problems with needles after this experience.
Which is definitely good. I mean, you had to endure a fair number of them just to get through to finishing off this process. I mean, if you had to look back now and I mean, just to give listeners an idea, how far out are we from the point of having done the stem cell?
We're about 6 months out.
We're about 6 months out. So, I mean, part of it is going to be hard to sort of look back and say, you know, and recall some of your experiences. But it definitely, the first couple of days afterwards are pretty painful and pretty uncomfortable. But, you know, sort of what was that like for you?
Yeah, the medicine definitely helped. It definitely relaxed me, but it was tolerable, especially when everything was on a timer as far as when I was allowed to take meds and how much I could walk. Or in my case, I needed to use crutches for a couple of days because it was pretty painful.
Yeah.
Yeah, everyone is a little bit different with how they respond to a stem cell injection post-procedure, like the next 24 to 72 hours. For the most part, though, it can be extremely uncomfortable. Your body has a significant reaction to the material being in the joint. It's almost a necessary thing that has to happen.
With the pain meds, you mean?
With the material being in there and it causing discomfort.
Yeah.
And so that's why we provide you with medications to get through.
Yeah.
So that, you know, you're as comfortable as possible. There are times, though, that we have had patients, you know, because we try to forewarn them that it can be uncomfortable and it can be, you know, a tough few days following the injection. Patients have asked, you know, I didn't have any discomfort other than usual. I don't know if the stem cell therapy worked. And, you know, we're a month or two out and it's, well, how is your knee doing now? And, you know, they say, oh, it's fine. I have no pain. And so then it's, well, then I guess, you know, the procedure is doing
exactly what you wanted it to do, right? I mean, the proof sometimes is in the pudding when you sort of are able to sort of go back to doing some things and not think about things anymore.
Right. So there is differences in how people respond, but for the most part, it can be uncomfortable. And we do provide those medications to kind of get you through the next few days following the procedure.
And again, I think that for me, I was already in a mental, I want to say like depression. Sure. I use that word, you know, somewhat lightly, but, you know, I was concerned about my knee. I knew that this had to work or I was back to the drawing board again. And so I think I really wanted this to work so much. And I knew that the pain of it was part of it. So to me, I felt like maybe this was the right course. Like it was working because it was pretty painful. And
some of this, the science behind that too is, you know, what we're allowed to do with stem cells and stem cell processes here in the States is that you're not really allowed to extract all the fat away or all the red blood cells away. And so sometimes when you inject these things that go along with the stem cells into the knee or the hip or wherever, it causes this inflammation. And you're absolutely right. In sometimes that inflammation or that pain gives people the sense that, yes, it went into the right place or, yes, something did happen. And you kind of need that mental trigger to say that, you know, you went through something or you went through the process. I mean, I'm sure people talk to you a lot about this before and after the fact. And you and I have had, you know, extensive conversations about how much people have talked to you about this. Before I, ask you what people have asked you, you know, from a cautionary tale standpoint or from a recommendation standpoint, what do you think are good piece of advice for people who are looking to do this? Like, what should they know before they ever do it, or what should they know immediately after the procedure is done?
So I think, you know, asking questions is the best way of healing. So before and after, both you, Dr. Kim and Craig, always answer my questions before, during, and after. And still now, I'm still having questions. So I think information is a good healer.
Yeah, meaning like if you knew, then you have maybe a little bit less anxiety about what was going on.
Yeah.
I think that's with anything, you know, being well educated on, you know, what's out there, what type of therapies are out there before you make any decisions, you know, with anything. And it certainly can ease people's minds. A lot of times we get patients that are anxious about these procedures, and, the whole procedure is kind of tough to get through because of the anxiety. But after, everything is done, after the stem cells are taken, they're injected, the patients will say, oh, wow, like, I can't believe I lost like a whole night of sleep just because of that. This was, so easy this was not as bad as I thought it was going to be. And so it definitely, being well educated, asking a lot of questions, doing your homework certainly can help ease people's minds and make anything, I guess, a little easier.
Sure, more tolerable and just better to approach, right? You had mentioned that you could have even started a blog just surrounding this process and this procedure. What are the sort of things that people you find coming to ask you about, and what do they want to know about it?
Oh, people are ruthless when they want to know about stem cell. I think because it's so progressive and it's not out there right now, and everyone just goes, the surgery route or the brace route. But people, they want to know if it's covered by insurance. That's the number one question. And how much was it? And, is it care credit or is it cash? Money definitely is the big problem with stem cell as far as the patient is concerned, and people taking the leap.
Have you found that people have asked you or had said to you, you did a stem cell procedure? I heard that that's experimental and, and it's not proven. Do you hear that a lot?
Yeah, I hear that. That's probably the second comment, and a lot of negativity about it because, again, I think it goes back to the education and asking questions. And it is progressive, or, at least that's my word for it, because it's newer and it's a little riskier because it is so new. It's, I think that's what attracted me to it more than anything else.
Yeah, I mean, at the age of 43, I mean, you're really you're fully prepared to look for some alternatives, right? Yeah. I mean, the usual and the conventional all sound like pretty intensive and pretty involved processes. So you're constantly looking for something else that is maybe a little bit less invasive.
Yeah.
Yeah. I can certainly see that. I mean, I think when it comes to some of the financial aspects of this, it is something that is not covered by insurance and therefore out of pocket. I guess in my defense, or I guess in the defense of stem cells, we're pretty transparent about it, though. You know exactly what it's going to cost from beginning to end, and there isn't anything sort of additional beyond that. I think sometimes when we do things by the route of insurance, things happen and you don't exactly know how many copays, how many medications, how many days off of work you have. In our process, we've worked that out pretty well. So not only do you have an exact cost of the procedure, but you know exactly how many medications you're going to take and how many days off of work you're going to have. Yeah. And so there isn't anything hidden about it. I do hope that with some of the transparency, it helps people make their decisions.
Yeah, I totally think that it did help a lot, especially with my job. And like you said, like taking time off, I was able to preset everybody, all my teachers and my children and their families. And as far as the money goes, to me, again, it was risk versus reward. And to me, I needed to take the risk to get to the reward of where I am now financially.
Craig, what are your sort of thoughts on that process? Because a lot of times, I'll have the conversation about what the procedure is and what the procedure's like, but then sort of when it comes down to the skinny on finances and stuff like that, I that's part that you often handle for us in the office. What are your thoughts and some of the barriers and helping people to overcome some of those barriers?
Right. This procedure, it's an investment, and you're investing in your.
But that's not oftentimes how we think about healthcare, is it? Like we don't think about it as an investment. It's a cost. It's like a taxation on like living life or something.
Well, it's difficult to think about it in that way, but when your quality of life is in question and you're in pain on a day-to-day basis, and you're constantly worried about your joint or your knee or your hip or whatever ails you, you put a monetary price on quality of life. On, if there is a viable option that you can go to that can give you relief from this, pain from these types of issues, would it not be something that should be explored? And, a lot of times people are at their wits' end, so to speak. So, they really don't have too much difficulty in making a decision.
Yeah.
By the time, our patients see us, they're decided. They know that, this procedure is what they want to do. They want to avoid a replacement or surgical intervention at almost all cost. And, if we're able to provide that for, our patients and to give them that option, I feel like it means a lot to, our patients and to the community that we're here. And, the patient is investing in themselves, but we're also investing in the patient. I mean, we're here. We pick up the phone and I try my best to be available to our patients post-procedure to answer any questions that they might have, get them through. I mean, are we pretty available?
Oh, yes, totally. And I ask a lot of questions. And, I think because it is such a newer process, both of you do a great job with what you know. But I think because we don't know a lot about it, we're sort of writing the story still of what a patient's point of view looks like throughout the process. But you both are always available to answer all my questions or to have a conversation about what it will look like in my future.
Sure. Thank you. We definitely appreciate that.
This investing in yourself, it's like a life change. There's a lot of changes that have to be made. I mean, what are some of the changes that we kind of facilitated or had you initiate prior to this procedure?
So I met with a dietitian here, and I was eating pretty healthy, but your body definitely needs to get ready for this procedure. And she was just confirming that everything that I was eating was what I should be eating.
Right. I mean, that's part of it, definitely, that, having the healthy lifestyle, or as healthy as you can coming into it is definitely going to be, one of the positive predictors, afterwards. I mean, if you're eating like junk beforehand and you're going to continue to eat like junk afterwards, I mean, that's, you're not going to have that sort of bigger impact. And, definitely part of the selection process is finding people who do have better lifestyle practices.
Yeah, I mean, nutrition is huge with health and well-being. Yeah. And it's tough to know what to eat and what not to eat because, there's so many differences and opinions. But definitely being conscious of what you're eating, what you're putting in your body, and being, cognizant of it and being aware is the first steps in changing, your lifestyle so that you're eating healthier and being more, self-aware of what you're putting into your body. You saw the dietitian. She basically reiterated that everything that you were eating was pretty healthy. You had a pretty healthy diet.
I did.
Yeah.
Yeah, she even allowed me my dark chocolate. So that was always a good thing. And she reminded me, to drink tons of water and more water. And I think throughout the entire process of doing my regimen here, I think my biggest tip for people is when you think that you've drank enough water, it's just still not enough. I think that was the biggest thing that the nutritionist had said is just keep drinking. And I felt so much different on days where I didn't drink as much as I did, from that first day on. And, not to get graphic, but when you do drink, it has to come out the other end. And that's sort of hard because you don't want to have to get up and move. So, that's mind over matter too, that, it's better for your body to drink the water.
To stay hydrated.
Yeah.
Sure. In sort of the last couple questions here, I guess one of the things that I want people to understand is possible in some of this, and in some of the early questions we talked about what you couldn't do. Give us a sense now what life is like for you now and what you are able to do.
Yeah. So now I'm not so conscientious of what I walk, where I walk, how I walk. One of my biggest goals during PT was that I was going to be able to wear high heels again. And I haven't worn high heels since my prom.
And you have? You have
And
one?
I did just
Good.
2 weeks ago.
Nice.
I wore high heels to a gala. And, it's the little things in life that are really pretty huge for me because, again, it goes back to the mental state of, always protecting my knee since I was 17. It was great. I do want to bring up about physical therapy because I did go to physical therapy after a few weeks here after post procedure. And it was tough work, but I went to someone that you recommended and, he was supportive. And because of the relationship that you have with him, you guys were able to toggle me back and forth and know exactly what I needed. And I think that was huge. That was a huge part of my recovery.
I think inflated for us to say that just by doing the stem cell process that it's going to cure all and be the panacea and make everything better. It is that leg up in putting you in the right direction, but doing things like a good course of physical therapy with a therapist who has great both foundational aspects and modalities is part of the process. So I mean, in doing this, it isn't just doing the stem cells and then going on and leading your life. It's so much more. It's about seeing the dietitian. It's about having the proper physical therapist. And it is about, sort of the way we do stem cells, which is a little bit different, but we really believe that, if you combine the best of everything, you're giving your knee, your hip, your back the best chance possible.
It's a lifestyle change. We want to facilitate a lifestyle change so that you're eating better and then, giving you the opportunity to be able to move more so that you can participate in physical therapy. Dr. Kim, why is it so important to, I guess, initiate physical therapy?
I think if you look at injury and cartilage damage or arthritis or back pain or whatever these things are, and it creates weakness because you use those muscles less. You'll use that joint less. You'll do activities less. You'll run less. You won't get on the treadmill quite as much anymore. And by making that lifestyle change, or let's say for the negative lifestyle change in your life, you develop these weaknesses in these areas. So even though we inject the material, you still have to overcome those weaknesses. And just simply going back to your activities of daily living or what we call the ADLs, it's not enough. You've got to build the big muscle fibers, the small stabilizing muscle fibers. And, albeit when you're in pain, you couldn't do that. Yeah. But here's your opportunity, right? Mm-hmm. I mean, here's your moment where finally things are at a point where you're not thinking about your knee. And to go on and develop some of those muscle groups, those muscle fibers, the tendon and ligament fibers that you sort of neglected for so long is an important part of this process. So physical therapy is 100% part of this. And we've seen it. We've done the procedure in people who, said, well, I know, I've been to the gym before and I know what I'm doing. And, we try to encourage people going to the physical therapist because that's where we've seen sort of the maximum of results. From our standpoint, is there anything you'd like to mention in addition, Olivia, something we haven't touched on? Any other point that you really feel like people who are listening need to know and understand about this process?
I just think that you're sort of, in summary, I guess I should say, sure. I feel like you were sort of talking about it without saying the words. Like, this is a team effort between dietitian and nurse and doctor and PT and people that help you at home. It really is a lifestyle change, like Craig said. And I definitely feel like I have the best team. And, now I am doing regular life stuff. I'm back at the gym. I finished PT. So it did work for me. And I think it's because we all put 100% into my knee.
That's a great point. Well, thanks, Olivia, for taking the time to spend with us today and go over this process. And we hope the listeners out there get a better idea of what this process is like, what this process with us is like. And we hope to have everybody listen and subscribe to our podcast in the future.
Great. Thank you.
Thank you.
Thank you for tuning in.